Radio for Justice brings you up to the minute news and conversation around the criminal legal system in Colorado and beyond. Welcome to Up to the Minute.
Welcome to Up to the Minute on Colorado Radio for Justice. I'm your host today, JoyBelle Phelan. I'm joined by Kyle Giddings from the Colorado Criminal Justice Reform Coalition. And Colorado is facing a major budget shortfall right now, more than $1 billion. And lawmakers are making tough decisions about where that money goes. At the same time, the state is running out of space in its prison system. Budget writers have moved forward with a plan to reopen a private prison to handle projected growth, even as cuts are being made to things like healthcare and other essential services. So we're at a real crossroads. Do we expand the system to make room for more people, or do we start managing it differently? There's also a bill this session, SB 2636036, that focuses on using tools like parole, earned time, and release processes to better manage the prison population that we already have. Today, we're going to dig into what's actually happening, what choices are being made, and what those choices mean for people across Colorado. Mm-hmm. Thank you, Kyle.
Always good to be here with you.
Good to have you here. So let's start with what's happening right now in Colorado that has put prison capacity and budget front and center.
Every conversation in every room right now around the budget starts with the question, what the heck is going on in DOC? Why are we spending tens of millions more on prison capacity, healthcare, staffing costs, all this, while crime is going down? Statistically across the board, violent crime, low-level crime, all crime going down. And yet our prison population is growing. And so we are continuously running into the issue of the fact that discretionary parole is down 12% year over year right now. Lots more people going back for technical parole revocations, as well as just the bottlenecks within the Department of Corrections. There's nearly 5,000 people past their parole eligibility date inside of DOC. Now, not all those people are like eligible to go home, ready to go home right now, but a good chunk of them are ready to go home now. But they don't have access to treatment. They don't have access to classes. They are struggling to find the resources they need to be able to do what is required of them by parole to go home. It's just wild stuff. So that's what's going on right now. And everyone's really concerned because we are cutting healthcare to kids. We are cutting healthcare to adults. K-12 is taking a hit. Everyone's taking a hit, but DOC is coming out with $90 million more. And so it leaves the question, what the heck is going on in DOC and what are we going to do about it?
Would it be fair to say that part of what has brought us here is it's a combination of people are not being released on parole. Mm-hmm. They are not getting treatment or classes. Yep. So this didn't happen in 1 year.
No, I would say the last 4 or 5 years, going in 2023 is when we started really ringing the bell about, hey, we're running out of beds. The prison population is growing not because of crime increases, it's just growing because of all these people stuck in the system, and we need to do something about it. So we were ringing the bell in 23, talking about the crisis related to staffing, and that's when Colorado Wins, the union that represents DOC workers, joined us in a report saying, we are in crisis, we don't have enough staff to cover the shifts that already exist. The continuous growth of the population is not only putting our lives at risk, it's putting the inmates' lives at risk and their quality of life at risk. So we've been ringing the bell for a few years and trying to run bills that Governor Polis has just kind of stood in the way of and stopped from either being introduced or getting a vote on the floor or any of that. But this year, Senate Bill 36 is moving through pretty well. It had its first hearing yesterday where it passed out of committee and is off to Senate Appropriations, which should be a pretty quick movement from there once the budget is completed.
So before we start talking about the bill, we're also hearing that the state could run out of prison space within the next year. Mm-hmm. How real is that?
It's real. There's no denying the fact that there is a bed crisis. We're not out here saying there isn't a crisis with how many beds they have. We're saying there's a crisis of what you're doing with the beds you have. There's a lot of low level offenses that are just stuck in purgatory. And then also like creating equity in the sense of like helping some of the JCAP kids get out faster. They're not kids anymore, guys. And, there's 11 people in the JCAP system right now just waiting for a signature, but they're sitting there. There's special needs parole folks. There's 66 people that have been already approved for special needs parole, but just have nowhere to go. And so why are we building capacity to just incarcerate more people instead of building capacity outside of the structural system of DOC to place some high-level need medical folks? There's 3 people in DOC right now that cost the state $2.8 million a year in just medical care.
Wow.
There's all these buckets of folks that we need to help get through the process and create avenues for them to get out.
So as things sit right now today, what happens when we run out of beds?
I think it depends who you ask. The Department of Corrections says if we run out of beds, then we have to start double bunking. They said they'll stop admitting people into the system and keep them in jail backlog at the county jails. So that's what DOC is saying. They're also like, that's why we want to buy a prison or open a new prison or contract with a private prison to open more bed capacity. And we're sitting here, it's like, we don't have to live this life. Like, this is not how things have to be. Like, we don't need to be in a constant state of crisis within the Department of Corrections. We can do simple things that change the trajectory of the population to take the pressure off, to like help maintain quality of life for not only the staff, but all those inside. It's time for us to really deal with those structural issues within a DOC to help alleviate the bed crisis.
The governor's office put forward a suggestion of we need to build a new prison. The JBC or someone else in that department said, no, we're not going to do that. But they put like $1 in the budget to hold. So walk us through that.
Yeah, it's complicated. It's actually really complicated budget maneuvering. Yeah. Governor Polis showed up on March 18th saying they wanted $200 million to buy the closed Huerfano facility in Walsenburg, Colorado, and that they may need to buy 2 prisons based on the current trajectory of the population. It's been closed for over 10 years. It wasn't in good shape when it closed, and it continues to not be in very good shape. And recently, the city of Walsenburg has been struggling with a lot of their water infrastructure, just the city themselves. There's about 3,000 folks that live in Walsenburg. This prison, between staff and if the facility was fully, every bed was taken, there'd be nearly another 1,000 people on top of the city. But the same week that the governor requested $200 million to buy this prison or start the process to lease it, their water system failed, and they had a boil notice. They had to boil their water before they could drink it. They had to drive to a local state park to take showers. And so, it's complicated. The mayor of Walsenburg is like, the closing of this prison is a failed promise to us. Now, I am pretty opposed to using private prisons or even state prisons to increase economic drive and mobility of a community. I don't think that's the right place to do that. I think there's a lot of other ways to get people good jobs besides prisons. But at the same time, the city was completely unaware that this conversation was even happening at the highest levels of DOC of, let's reopen the private prison or let's buy the private prison. They had no idea this conversation was happening until it broke in the news and reporters started asking them. So the fact that Walsenburg had no idea this was coming and then just bloop dropped it, it just tells you how great this process is going. But it was estimated to need $60 million in repairs. The governor keeps talking about how we need all these repairs to get it up to a level 3 facility. So replacing the doors and the toilets. Walsenburg has only ever been open at a level 3 facility. So it's already a level 3 facility, which means they need to replace all these things because the whole building is probably failing, but we can't get any information. We did a core request asking for all the due diligence paperwork that they did when they were doing the research on buying it or leasing it, and just got some really silly emails back and no real information. And so JBC said, no, thank you. You cannot buy a prison. Not in this budget crisis, not in everything that is going on. And no one on JPC wants to commit to a whole new prison, just knowing how broken the Department of Corrections is and the infrastructure around it.
you started to talk about it earlier. Let's talk about staffing and the union, right? So if we're expanding capacity, whether it's Werfeno or someplace, whatever, wherever it is.
Yeah.
So in facilities right now, still staffing shortages being what they are. If we somehow expand bed capacity, where does that staff come from?
Last time when it was Werfeno, they pulled a lot of people from Walsenburg to come work at that facility, but then they're also going to have to pull people from other prisons. Like I know when Kit Carson was open, they moved people in from Nebraska. There's people from Puerto Rico who were like living in a prison down in Canyon City for a little while as guards. It was just, they were living in the prison because they couldn't get housing in Canyon City. So they hired these guards who didn't speak English, who like had no experience being a prison guard inside of an American prison, living in the prisons. it was wild.
Yeah, I remember when that story was on the news. I was like, what is happening right now?
I don't think they knew either. But no one knows where this staff, like Andre Stansel, the head of DOC, said it best. DOC will never return to the staffing levels pre-2020 in the pandemic. They'll never return to that. And their response to that is like, well, everyone just work more instead of figuring out like, how do we deal with this issue? That's what we would love to figure out. Everyone points to everybody else. That's their problem. That's their problem. That's their wheelhouse, their wheelhouse. And so we actually proposed a working group compiled of not only community stakeholders, a formerly incarcerated person, but also DOC and members from Colorado Winds, the staff, like a day-to-day staff, not like some executive level.
But like line staff.
I want line staff. Yeah, I want someone who's working case management before they jump onto this meeting. And so it looks like we're going to get a working group too. That's not just a like around for a few months, makes a report, disappears into the wind, but is around and can help for over the next couple of years figure out how to deal with these structural issues inside of the Department of Corrections. Because the next governor, whoever it is going to have a lot to deal with, and lean into the people who've been doing this work, like CCJRC, for a long time to help them figure out how to get out of it.
If we're in a budget crisis, and at the same time, we're looking at spending literally tens of millions of dollars, right, on prison capacity. I'm curious how the legislature are weighing those priorities.
Yeah, the conversation just changed dramatically in that building. Where, like I said, every meeting about the budget starts with what the heck is going on in DOC. Each party has a caucus meeting when the budget is released. And they talk about priorities, what the budget does. The Joint Budget Committee members that belong to that party do a whole presentation. And in the House side, the first 45 minutes of this 3-hour meeting was only talking about DOC. And the JBC members being like, we hear you, we don't disagree with you, but we have to lean into making sure the counties aren't suffering endlessly, because they get paid $77 a day to hold someone inside the county jail. It costs an average of like $130 a day to hold that person. So they're losing money. They're trying to weigh that and making sure quality of life for people inside of DOC doesn't dramatically change. One thing that also was in the DOC budget this year was an increase to the private prison per diem. So moving it from, we're at $63 or $68, I can't remember, to $77, and then eventually $80 after next year per day per inmate. And that's a 20%, almost 20% raise. It's like 18.6 something. So we have been talking about like, that makes no sense. Like they've only ever come in for like 2 to 3% to show up for asking for originally a 20% increase. That is like, and it doesn't increase access to treatment, doesn't increase access to resources or quality of life for the people inside. It is programs. It is just purely profit. It's like in a year where we have no money, we're giving a private prison corporation who's also associating themselves and like also a partner in the ICE detention centers throughout this country that are turning into just little concentration camps. Like, what are we doing? And so some people heard us talking about that and they went for that money. And so they went and they passed a budget amendment to take $6 million out of the $11 million that was there to return healthcare to children from a program that was being capped and turned off. Cover All Coloradans, which helps families of mixed status, legal status, gain access to health care and reproductive care. Great program, does wonderful work. It was capped and was being canceled. So they managed to do a budget amendment that took $6 million to give these people health care.
Oh, wow.
Amazing work. Just sitting in a footnote for if they do need to increase caseload so they don't immediately blow a hole in the budget. So people are like, no more. We're going to raid the DOC budget and take this money and put it where it belongs, which is in the hands of everyday Coloradans that are going to suffer the most.
So in a previous Up to the Minute, we talked about how when the JBC said no, like the funding of the 900 some odd beds, that there'd been that back and forth of yes, no, yes, no.
Yeah.
We had a conversation that was being used as a leverage point, and that DOC, the intent of the back and forth with that money was figure out a plan, and that DOC was operating in good faith, trying to put together a plan. Where are we with that?
Where's the plan? So
I mean, is it still? It's going to take a while to create, but
100%.
Are there steps in building a something?
Yeah, yesterday at the Senate Judiciary Committee was like the biggest formation of that plan. There was one bill, which is a second look bill that passed earlier this session that's sitting in appropriations that they're trying to figure out how to find some money for. But there was a slate of other bills that came out of Senate Judiciary yesterday. One was Senate Bill 36, the Prison Population Management Measures. There was a rewrite of the JCAP bill law to help bypass the governor to get these folks out. That's what he's wanted. And Dylan Roberts, who killed it last year, voted for it this year. Okay. So I don't know what they changed, but they changed it. And then there's the DOC's requested earned time stuff, which is a few days here and there, which is fantastic, but
it all adds up.
All adds up, and then includes the working group. Okay. And so the plan's coming together, but the big structural plan is connected to that working group.
Right.
And we've had commitment from the governor to sign the bill, and so we expect to get rolling on that pretty quickly after session's over.
I think the best way to describe it is it takes a village. The DOC, like one entity by themselves, is not going to solve everything. No. Like to your point around the working group, we need a group of people. We need a group of minds. We need people that are in it. There are so many folks that would love to have a ton of input in, here was my experience. Here's what worked. Here isn't what didn't. They're not going to get out all by themselves. It's going to take a village. We talked about what is driving the increase is not crime.
Nope.
Less people are being released. More people are sitting in county jails waiting to come in. More people are going back on parole revocations. It's not that crime is up in your local community. So there's a bill this session focused on managing the prison population using tools that already exist. That's the SB 2636 that we talked about. What is this bill trying to do, and how is this bill different from the previous prison population?
Yes. So the 2018 bill, the Prison Population Management Measures, passed unanimously. And we thought it had the teeth and the buckets and the mechanisms to help folks get out if they fall below 3% for 30 days. It doesn't. And it had areas where the governor was able to manipulate and kind of get around the system by keeping people in jail backlog because they don't count against the vacancy rate. So it allowed the bill to never go into effect. But even when it did go into effect, of the 235 people that were marked as qualifying to be able to be released under PPMM, the parole board decided to only release 12. So it's just, they still have a parole board problem. So the new PPMM, increases that vacancy level from 3% to 4%. Because from what we saw across the nation is most prisons need about 2.5% of flexibility to move people around. What if a water main breaks or there's a fire, like 2.5% of emergency bed movement kind of stuff. And so we bumped that number up to 4%.
So there's more wiggle room.
More wiggle room. And then also they have to get to 5% for at least 30 days for the mechanisms to stop. Okay. So we feel like 5% is like a reasonable number. Like 5% is still a lot of people in prison, but it gives you enough runway to figure some stuff out. Okay. And so there's that. We made sure the jail backlog was included. And then we added a bunch more buckets of people, including people who have really good institutional like behavior, who are in level 1 or 2 facilities. Like some of these facilities don't even have a fence. So we should trust these people to probably be able to go home if they've proven themselves throughout the rest of their programming. And then also there's just like a lot of different mechanisms that like require people to actually take accountability for how these mechanisms are implemented. Because right now it's just like, well, we tell a bunch of people and then hopefully stuff happens. We've changed that to make the head of DOC in charge of how the PPMM is being implemented if it's triggered. We also put it in place to where the Department of Corrections has a lot more responsibilities. So if none of these other mechanisms that we're putting in place work and the parole board is still denying a lot of people, there's a new mechanism that any people within 90 days of their mandatory release dates, the DOC gets to make their own list and be like, we've lived with these people, we've seen how these people work, and we think they're ready to go home. They make their own list and start letting those folks out.
So if you're someone in the community that is concerned about public safety, so is what you're saying, these people, however many there might be, they do not go in front of the parole board. DOC can make the decision of, hey, you've done whatever the criteria is, out the door.
So if they have victim notification, they would still get notified. Okay. They if they were within 90 days of their mandatory release date, DOC can pull their list and just give them 90 days of earned time.
So they'd be leaving.
They'd be leaving anyway.
Okay.
It's not. This is not the discretionary parole, folks.
Okay.
This is the people headed out anyway in 90 days. Okay. And so it allows them to give them 90 days of earned time and send them on out. And so that is like the last bucket. It's just like, DOC, you run your own facilities. You know who's in your facility that's likely ready to return to community. You're going to make that choice.
Are we trying to manage the system differently or just make room for more people?
We're trying to take the pressure off. DOC is a pressure cooker right now. The population's growing. I call it riot soup is cooking right now. And so the PPMM was never designed to like let out a ton of people or anything like that. It was designed to help take the pressure off, bring us up to a safer level. Now this working group can come in and figure out the structural issues that are just keeping people clogged in to begin with. So our hope is PPMM, the JCAP rewrite, the second look bill, the earned time from DOC stuff can all work together to keep the pressure releasing properly on the DOC, on the pressure cooker that is DOC, so we have time to go in and deal with the structural issues before a new prison needs to happen or a riot happens or anything like that.
I think sometimes when people are talking about the prison population, it's sometimes really easy to forget that we're talking about people that we love and care about, that at some point will be our neighbors.
Yep.
And so I'm wanting people who are listening today to remember, if they don't have a loved one inside, I want them to remember that we're actually talking about people who live and work in this pressure cooker.
Yeah.
And it's not like as a volunteer who goes in, right? Like we're seeing the impact. You hear from people, CCJRC as a whole hears from people inside. And so I'm wanting to make sure we remember we are talking about human beings who live and work there. When we're in this pressure cooker component, what is this doing to the people who are living and working in that space?
95% of people inside of DOC will come home one day. 95%. And the situation that they're in, the letters we get and the phone calls we get and family members reaching out is a lot of despair. It's a lot of people being like, I don't know how I will ever qualify for discretionary parole. I have a really long sentence, but I can't get treatment. I can't get access to the classes I'm required to teach or take to be able to get out. Family members are scared to push back against DOC too, and for their family member not to be retaliated against. Like I think about the youth out in the YOS system who were literally being starved and I know we've passed some laws and have been doing some work to help with that situation. But many of the family members of the YOS youth, so the YOS facility is the youth offender system, are scared to publicly say anything because they think their kids are going to be retaliated against. And that all feeds into that pressure cooker. When I talk with the guards and the case managers and the parole officers inside of DOC, they're just exhausted. Their mental health has completely collapsed in some cases. And there's some, I was meeting with a bunch of Colorado Winds DOC workers last year. And they talked about one of their coworkers who committed suicide. And they talked about their coworkers. There was one or two that passed away from crashing their car because they just worked a double and didn't stay awake. He was tired. Yeah. And it's a deadly system that's being put together. And it's important that we work diligently to equip the people who can do something to change it. And then if they don't want to be equipped with that we work together to make the laws change what they're able or not able to do.
What should the general taxpayer, voter, person interested be paying attention to on what sort of time frame?
Yeah, for sure. So once the budget is done after this week, things are going to hit hyperspeed because we're less than 30 days before session's over. And so we have to get all these bills that went through Senate Judiciary yesterday through the Senate and over to the House and through their committees and back through again. And so it is more important than ever that we work tirelessly and endlessly to reach out to our elected officials to let them know that this is a problem that we want solved. These are the bills we want to have solved. So if you go to CCJRC/get involved, you can sign up for our newsletter as well as all the different events we have going on. We're doing a lot of packing the committee rooms to make sure legislators see that there's a lot of community behind these bills that want them passed. Now we're not asking even people to testify. We're just asking them to come sit in a room and wear a button and look cool. And so we're working endlessly to get these bills across the finish line. And so wherever they can send an email, we send a lot of action alerts these days, asking people to reach out to legislators. So make sure you sign up at ccjrc.org/get involved to get all the updates on how you can get involved in fighting the good fight.
All right. Well, thank you so much for your time today. Folks, I'm your host, JoyBelle Phelan. I've been chatting with Kyle Giddings from the Colorado Criminal Justice Reform Coalition, and we appreciate you listening to Up to the Minute on Colorado Radio for Justice.
Up to the Minute is a production of Colorado Radio for Justice. Tune into our 24/7 broadcast on www.radioforjustice.org. Listen on the app from the App Store and Google Play. Catch this show and other original works shifting the narrative on the criminal legal system on Apple Podcasts, Spotify, YouTube, or wherever you get your podcasts. Colorado Radio for Justice.